this is going to be a long one. So let me start off by saying, in case you don't make it all the way to the end of the video, you know yourself, you know your body, you know how it feels, you know when something is wrong with you. Never let anyone, nurse, doctor, try to send you home if you know something is wrong and something is going on. Because they were trying to send me home. I would not be alive today had I let that happen. So you need to be your own advocate and speak up and say, something is going on with me. Will you please help me? No one else is going to advocate for you but you. So I don't know what your religion is, if you have faith or if you believe in an afterlife or if you're just spiritual. But I will say this. I believe in God, and there was a lot of supernatural stuff going on around me when this happened. And I'll get to that later. But it just, not only strengthened my faith, but it made me feel like I have a more personal relationship with God, because I felt like he would, out of everything that was going on in the world, I felt like he was right there in the room with me, as well as my mom and my grandma, I'm sure. 2 weeks ago on a Tuesday, I wake up with a little bit of a stomach ache, and I'm thinking to myself, maybe it's like a UTI. So I take some cranberry vitamins and I drink some water, and now I'm off to work. I'm working, and the stomach ache is now like spreading out through my whole abdomen. And finally at noontime, I'm like, I gotta go home. Like the pain is insane. So I go home, and my girlfriend's like, oh my gosh, you left work early? I'm like, yeah. She's like, oh, okay. So I just doing what I can at home, making calls, doing emails. Now the pain is getting so bad that I decide to lay down. So I go into the bedroom, I'm laying down, and there's nothing I can do to get comfortable. No position I can be in. Like, the pain is just incredible. And my girlfriend, I can hear her walking down the hallway, and she stops at the bedroom door, and she's like, oh, are you laying down? Because I never lay down. From the minute I'm up in the morning, I'm on my feet all day until I go back to bed at night. I'm either, working, doing housework stuff, shopping, YouTube stuff. I'm never sitting or laying down. And she's like, ooh, maybe you should go to the hospital. And I'm thinking to myself, no, I don't want to go to the hospital. No way, not going to the hospital. So the laying down's not helping me. So I decide to just get up and maybe try to stretch, but I can't really. And then all of a sudden it just comes over me. I feel like I'm going to be sick. So I run into the bathroom and I start vomiting and vomiting and vomiting. And I'm thinking to myself, okay, maybe this is good. Maybe I ate something that's bad and it's just got to come out. Usually when you throw up, you feel a little bit better afterwards, but I didn't feel better. The pain was just getting worse and worse and worse. And my girlfriend's like, that sounded awful, what happened in there, and I really think you need to go to the hospital. And I'm like, no, I don't want to go to the hospital, because I'm thinking like, I have pretty crappy insurance, and I'm like worried about the bill. That's why I didn't want to go to the hospital. I keep chugging along, I took some more Advil. I just wanted the pain to go away. Finally, after all of these hours of suffering, I was like, I can't even stand up straight. I'm like all bent over. And I'm like, okay, I think I should go to the hospital. But of course, now it's COVID, so she just basically has to drop me off at the ER and leave. So I go in there, they're triaging me, and the nurse is like, what's your pain level? I don't want to look like a total crybaby, so I'm like, oh, it's about an 8. Really, it was well beyond a 10. So I'm waiting for a bed, and this old guy's behind me, and he's like, thumbing through a newspaper, chatting up the young nurses, laughing. And they ask him what his pain level is. And he's like, oh, about an 8. And I felt like saying, wait, I changed my mind. If he's an 8, I'm like at about a 50. That's how bad the pain was. Now the ER is crowded because it's COVID and we're getting hit again really bad. So there's no empty rooms. I have to lay on a stretcher in the hallway. And I couldn't even lay down. Like, I was just sitting on the bed, like rocking back and forth, holding my stomach. And I have that little throw up thing they give you because I kept like having the dry heaves. This one girl looked at me who worked in the hospital, and she's like, I'm going to get you a bed. Hold on. So she hurries up and like cleans up a bed, and she's like, okay, go in there. Because I think she could tell that I was really suffering. So the next nurse comes in and she's like, okay, well, we need a pregnancy test. And I'm like, I don't think I can do a pregnancy test. Like, I just threw everything up. I don't have anything in me. She's like, if you don't do a pregnancy test, no pain meds. Okay, give me the cup. So I grab the cup. All I want to do is just make this pain end. Fortunately enough, I had a little bit of urine to give the sample. The doctor comes in. I describe my pain, what's going on. They administer pain medicine. They draw blood. And after they give me the pain medicine, I'm like waiting for it to like kick in. Because, I've taken people to the hospital, and as soon as they put the pain medicine in, they're like, oh, thank God, I feel so much better. That didn't happen for me. Like, I'm like, when is that going to kick in? Give it a couple minutes, it'll kick in. The pain meds never kicked in for me. So the doctor comes in and he says, okay, your blood work is fine. You don't have a fever. We're going to send you for a CAT scan with contrast in the IV. So I go for the CAT scan and they wheel you through the hospital in this wheelchair, and every bump they hit, it was just like, oh, like it was painful. Every little move I made was just terrible pain. I finish the CAT scan, I go back, and I'm just trying to, get comfortable on the bed, which is not working. Doctor comes back in, he's looking at the CAT scan results, and he's like, there's nothing here. So I think what we're going to do is have you follow up with a GI doctor, because I suspect you have colitis or perhaps a stone. I'm like thinking to myself, oh my gosh, they're trying to send me home. Like, they're literally prepping me to go home. And I said to the doctor, I can't go home. I can't even walk. Like, there's no way I can go home. There's something wrong with me. So he's like, okay, we'll keep you overnight for observation. It's like he begrudgingly allowed me to stay in the hospital. And in my mind, I'm thinking, is this because that I have insurance? Now, because it's such a small town, like, I know a lot of the people in the hospital. My girlfriend's twin sister works there. So she called some of the nurses on the floor just to say, that girl is family to me. Take care of her. I'm like, will you please get me something to drink? I'm so thirsty. And by the way, I have the mask on. She's like, you can take your mask off. This room is your safe zone. And I'm like, nope, I'm leaving my mask on. There was somebody in the room with me who didn't have a mask on. The husband was in there. He didn't have a mask on. There's no way I'm taking this mask off. And she's like, we can't really give you anything to drink because we don't know what's going on with you. And I was like, I'm so thirsty, please. So she did bring me some ice chips. I'm like, can I get some more pain medication? Like, I'm in so much pain. You can only get pain medicine every 4 hours. I kept a sharp eye on that clock. Every 4 hours, I was ringing that bell because that's how bad the pain was. And I couldn't sleep. There was no way I could sleep. I just kept moving around on the bed, just trying to get comfortable, trying to get to sleep, but there was just no way that was going to happen. So I was there all night. Like, when you're in that much pain, that's all you're focused on. You're not thinking about texting people or letting them know what's going on. So it was like 11 o'clock the next morning. By this time, I'm up on all fours in the bed. I'm kneeling on my hands and knees, just rocking back and forth like, oh my God, God, somebody help me. Oh my God, that's how bad the pain was. My girlfriend walks in and sees me like that, and she's like, are you still like this? Of course, like, her first instinct is to come over and put her hand on my back and touch me and comfort me. And I just turned to her. I'm like, please don't touch me. Everything hurts. Please don't touch me. And when I turned to look at her, she realized that how swollen I was. Like, all the IV fluids they had pumped into me, I was just swollen like a tick. So she's beside herself. She just doesn't know what to do or if she can do anything for me. And she's trying to talk to the nurse. And the nurse is like, we've checked her blood throughout the night. There's nothing going on with her blood work. She doesn't have a fever. She looks fine. For all intents and purposes, this is a healthy woman. So I said to Amy, listen, just go home. Go home, because there's nothing you can do for me. I don't want you to see me like this. Please just go home. So this continues on, where I'm just trying to get in any position to get comfortable on the bed, trying on my side, on my back, and finally I'm on my hands and knees again and just rocking back and forth, and just, I'm begging someone. Like, you can't believe you're saying these things out loud, but I literally was just rocking back and forth saying, oh my God, please help me. Please help me. Please, somebody please help me. And my call button goes off, and the nurse is like, can we help you? And I was like, I didn't ring the bell, but I'm in a lot of pain. She's like, well, somebody rang your bell. So, but you can't have your pain medicine now. And I was like, no, I know. Like, I have to wait the 4 hours. I'm still in agony. I'm rocking back and forth, and I'm still crying out for God or someone to please help me. Again, my call button gets rung. I heard the nurse come on. Can we help you? And I'm like, I didn't touch the call button, but I am in a lot of pain. And she's like, I understand, but you're not due for your medication yet. The call button hits are probably 20, 30 minutes apart. And again, a third time, the call button is rang. And now I think the nurse is getting a little annoyed with me. I'm like, listen, I promise you, I did not hit the call button. But I was crying out for God to help me, to please help me get rid of this pain, because it was just so incredible. So I really think that, he heard me crying out to him, and he was there. I really believe my mom was there hitting the call button too, because it just so happens that like I was really thinking of God, my mom, and my grandma. And 3 times that call button got hit. So it made me feel like God was there, my mom was there, and my grandma was there. Like they heard me, they could understand how much pain I was in. I'm still on my hands and knees. I know I'm not getting my pain medicine. Who walks in but the doctor? And now it's like already late in the day. It's like 1:30. And he walked in and he's like, oh my gosh, are you still like this? I grabbed that doctor's arm and I said, please help me. Oh my God, will you please help me? I'm in so much pain. I can't stand it. I just can't take it. I can't stand it anymore. Please help me. Now, bear in mind, I'm not crying. I'm just telling him I'm in agony. Please help me. You know, the doctor says your blood work is fine. You don't have a fever. Like you say you're in pain, but there's nothing to indicate that anything is really going on. Okay, so this is what I'm going to do. He gave me something immediately for pain again, and he had my pain medicine moved up to, instead of every 4 hours, I was getting it every 3 hours. And he also put in that I needed a CAT scan with contrast that I drank this time. So the nurse comes in, she's like, okay, the contrast, you're going to have to drink it, but we can't send you right away because we have to empty out the ER. Once all the ER people are done, then you can go for your CAT scan. And I was like, okay. So it's like 10 o'clock at night. This whole time I'm still in agony because the pain medicine doesn't help. The pain medicine maybe would dull the pain for like 20 minutes and then it would wear off. There was just nothing that could touch this pain. And they said that they were giving me Dilaudid, which is like the strongest thing that the hospital gives. And still, that just was not helping my pain. So 10 o'clock at night, here comes the guy with the wheelchair. He's like, transport, I'm going to take you down to CAT scan and get your CAT scan. I'm like, wait a minute, I haven't even drank anything yet for the CAT scan. And he's like, oh, we'll figure it out when we get down there. So here he goes. He's wheeling me all through the hospital. Every little bump and groove that was in the floor was so painful. I'm like, like I'm all bent over. Like I can't even stand up straight in the wheelchair. I'm just hunched over. I get down to CAT scan and the guy's like, did you drink your contrast? I'm like, no. He's like, send her back up. She's got to have contrast. There's like a shift change. I get a different nurse. And she's like, remember how you're saying how thirsty you are? She puts down the contrast and a big pitcher of water. She's like, you need to drink 2 of those in order to get the CAT scan. I didn't care. I was so grateful to get water. I chugged the contrast. And she's like, oh, everybody usually complains about that. I'm in so much pain and I'm so thirsty. Let's just get this done. I want to know what's going on. Finally, I get down to the CAT scan at like midnight. I go back up to the room. I don't even really remember when it happened, but somebody came in and said, it looks like it could be your appendix. So you're probably going to get operated on tomorrow. And I'm thinking, okay, good. My God, at least I'll be able to get this out and my suffering will be able to stop. But now the whole night again, I'm still in complete agony and I'm suffering. No position I can lay in is comforting. There's just nothing I can do to get out of this pain. So the next morning, there's this guy at my door with a wheelchair and he's like, hi, I'm going to take you down for an ultrasound. And I was like, okay. And I get out of bed and I'm walking over to the wheelchair and he says to me, are you okay? You know, do you usually walk with a walker at home? And I'm like, no, I don't use a walker at home. So I get down to ultrasound and the tech is like, okay, we need to give you a pelvic. And I was like, pelvic what? And he pulls out like this big thing and it has to go downstairs. And I'm like, nope, no way. That's not happening. No, forget about it. No way is that happening. So he looks at me and he's like, okay, well, you're pretty thin, so I guess we can just get away with a regular ultrasound. So he's going all out through my abdomen, and I'm trying to explain to him, okay, like, yes, it hurts right there, but it hurts up here. Like, my whole abdomen was incredibly painful. I go back up to the room, and I can't wait for the operation. All I want to do is see that mask come over my face and I know I'm going to be knocked out. At least I can sleep, be unconscious, and be out of pain. Like I wasn't even worried I was going to die on the table. I just wanted to be out of the pain. So finally at like 11:30, a nurse comes in and she's like, let's get you dressed for the OR. When you're in that much pain, you have no pride. I literally was just started stripping off my clothes because I wanted to get into that gown and get on the table. And she's like, oh, let me close the door first. You want some privacy? And I'm thinking, to heck with privacy. I don't care. I don't care who sees me. And anyway, my stomach was so distended. It looked like I was pregnant. That's how bad my stomach was sticking out. Now I go down to pre-op. Next thing I know, the doctor's coming at me with a clipboard. He's like, I need you to sign this. I was like, okay, what is this? And he's like, this is just to say that you understand I may not be able to alleviate your symptoms. And I'm like, what? What do you mean you may not be able to alleviate my symptoms? Like, what? Like, I can't be in this pain. Like, what are you talking about? He's like, yeah, the CAT scan showed like maybe your appendix was a little enlarged. I mean, nothing that screams appendicitis. Your blood work is fine. You don't have a fever. Like right now, it's exploratory at this point. I don't know what I'm going in there, what I'm going to see, what I'm going to find out. Give me the clipboard. Just I just scribbled my name. I'm like, just get me under. I just want to be put under. So I get to the operating room and thank God I saw that mask coming over and I started breathing really fast because I just wanted to be knocked out right away. Naturally, the only thing you remember next is waking up in post-op. And one of the nurses is like, Tammy. And like, I'm opening my eyes and she's like, we took out your appendix and it had gangrene all over it. And I'm like, I heard the word gangrene and like it brought me back to elementary school, reading history books about, the Civil War soldiers, the poor amputees, they had to worry about gangrene setting in. Like, I'm thinking, gangrene, how did that even get in there? Like, how did that become gangrenous? How did that even happen? My aunt had the same thing, except hers had ruptured. And she said to me, what happens is the appendix, once, there's a problem there, then it basically starts to rot away. It becomes gangrenous and then it ruptures. And then once it ruptures, it allows your bowels to spill into your stomach cavity. And then you go septic, but it's a very, very, very painful death. Now, I know what you're thinking because I was thinking it too. Once I had the surgery that I would be out of this pain. You would be wrong, and so was I. I was out of like the sheer utter agony, but there still was a lot of pain going on. And in case you're not familiar with laparoscopic surgery, which is how they removed it, they basically fill your abdomen up with gases so that it pops out so that they can stick the camera in there and the probes and the thing to grab out your organs so that they could see what's going on. So that gas just sits in there. You're not a balloon. Once you're done with the surgery, they pop you and all the gas goes out. It has to work its way out of your system. Meanwhile, you're swollen. And I'm swollen anyway because the IV fluids, because I'm not sleeping, my body is not metabolizing them properly. One of my subs, Bad Karma, kept texting me. He's like, you should document this. Like, you should be filming this for YouTube. It's such agony. There's no way I was thinking about that. Now I'm back up in my room and same thing. At least I'm not in that sheer pain, but I'm still in pain. And I call for my pain medicine. Now, because I had the operation, they're not going to give me Dilaudid anymore. They're giving me Percocet. So she flips me a Percocet and I'm like, so I just take that. Okay. And she's like, you can go home tonight if somebody picks up your prescriptions from the drugstore. So I call my girlfriend. I'm like, listen, if you pick up my prescriptions before the drugstore closes, I can go home tonight. And she's like, what? They're going to release you tonight? Like, I can't believe it. I'm like, yeah, please go pick them up. I just want to get out of here. The nurse is like, you have to eat something first. If you can eat it and keep it down, we'll let you go. I was like, okay, what do you got? I got Jello, strawberry, lemon, or lime. I'm like, give me the strawberry. So I ate all the Jello really quick and it felt good to just put something in my body that was solid because I hadn't eaten or drank anything besides the contrast for days. So that was it. Never saw the doctor again. They didn't really give me any directions about, what it was going to take to recuperate from this surgery. Nothing. I left. I just got on the wheelchair and I went home. Now I'm still in a lot of pain. And now, because I had the gangrenous appendix, I have to be on super strong antibiotics. Lucky me is allergic to penicillin. So the only thing I can take is Cipro. Cipro is harsh. It's like taking acid. It's terrible. It's just terrible. And I have to take that along with a bunch of other stuff every 4 hours. And it was just torture because now that's going through my system and that feels like acid. And same thing, I couldn't get comfortable. There was nothing, my back hurt so bad. I kept ice packing it. I just kept an ice pack on my stomach, on my back. Like the more days that went on, I felt like the worse it was getting. I would have gone back to the hospital if it were not for my neighbor. He's like, they really should have talked you through this at the hospital, but trust me, it's just, this is what has to be. The next day, because I'm still not sleeping, my body is not processing any of the gases or any of the IV fluids. And I'm just still swollen, except for now that I'm walking around, all of that fluid is down in my legs. My legs were huge. I should have snapped a picture of my legs. I did snap some before and after pictures of my stomach so that you guys can see. Now, the pictures are really not going to do it justice because I didn't have a before picture, like a jumping off point. You know, people like snap pictures of themselves like in bikinis. I never do that stuff. So I don't have anything to gauge by except to say I was huge. Now my legs are just incredibly swollen, and he's just looking at them and he's like, that's not right. He's like, you either have a blood clot or you need like a medication like Lasix to get rid of that, because your legs are crazy huge. So I called the doctor to see if maybe he could give me Lasix, but he's on call and I have to wait for him to call me back. But anyway, he never calls me back. So my friend says to me, you need to elevate your legs. This way the fluid will drain out of them. And I was like, oh, okay. So I elevate my legs. I kept them elevated for 4 hours. Now all of that fluid, it drained out of my legs right on back into my abdomen. It was so incredibly painful. Not as bad as the gangrenous appendix. Let me just clarify that. But it was painful. And I said that I don't care how big my legs are. I don't care. I'm not doing that again. Let the fluid be in my legs. They're better off in my legs than in my stomach. This whole time, I'm still barely eating or drinking anything just because the whole gut is just raw and just, it hurts really bad. So now, because I've been on this Cipro and it's so harsh, and I'm not used to taking medications. I don't drink alcohol. Like, I eat a pretty healthy diet, so my body is not used to all of this stuff. Now I have a new pain. I feel like there's an inner tube that's inside of me underneath my rib cage, and it just wraps around my whole body, and it's just pushing on my other organs, and I feel like I'm gonna throw up, and it's just incredibly painful. Not as painful as the appendix, let me just say that, but it's very painful. He's like, no, I know what's going on because your body's not used to all of this stuff, like these antibiotics and all this other stuff that's going in your body. You probably have a bout of pancreatitis. All you can do is just ride that out. I'm like, well, maybe I'm going to skip the medicine tonight because I just can't take it anymore. And he's like, you really can't skip your antibiotics. Not when you had a gangrenous appendix. No way. You have to make sure you take that on schedule. Any little bit that's left in there and that antibiotic is not there to kill it, you're going to become infected, septic, and probably die. So you've got to take the medicine. I struggled through the bout of pancreatitis, and like he kept saying to me, day 3 and 4 is going to be okay. Day 5 is like a magical day. You'll feel as good as new. So like all this time has gone by and day 5 comes and I'm still not better. And he's like, okay, day 10 is really the magical day. I'm like, wait a minute. What happened to day 5? I just kind of said that because I wanted you to have something to look forward to. It really did take me a good solid 2 weeks to recuperate from that operation. And I'm still not like 100%. It hurts to bend. It hurts where the incision parts were. It hurts where the appendix used to be. And I can't eat anything too much. Like, I have to eat small meals throughout the day. It takes a long time for your body to bounce back from that. And they said the older you are, the worse it is. So when I hear these people, someone had open heart surgery, and I think to myself, okay, well, at least they had painkillers, I'll be okay. No, I feel so bad for these older people that have these operations. Like, I can't imagine how much pain they're in and what they're going through. So if you know someone who's post-op, please be very patient with them and very caring with them, because I can tell you they're in an insane amount of pain. Even if they say it's laparoscopic, it's no walk in the park. It takes a lot to get through surgery, and you just have to take the time that you need to get there. And did I mention I worked that whole time? So even though I was supposed to be home recuperating, I had to go to work because I had to make sure stuff gets done and orders go out and stuff happens. Like, if I don't go to work, I don't get money. Like, I have to make sure my orders go out so that I have money in the bank to pay all my stuff. Thank God, my family was a big support system. Amy was a huge support system. And of course, it is through the grace of God alone that I made it through that. Looking back now, I still can't fathom that I sat in the hospital for 2 days, 2 full days with a gangrenous appendix and lived. Usually when somebody goes into the ER with appendicitis, they rush them into the OR right away because it's such a dangerous thing. That always has the potential of rupturing and causing mass problems. By the grace of God alone, I'm here to tell you the story. So now I have to go to the doctor for your post-op evaluation. He just wants to make sure your incisions look good, everything looks good, that you're, on the path to recovery. And I'm just so grateful to be alive. I said to him, thank you for listening to me. Thank you for saving me. Thank you. Because the guy could have sent me home. And he said to me, you had the most underwhelming blood work that I have ever seen in my life. Normally somebody has appendicitis or something. It's there in the blood work. We can see what's going on with them. And I said to him, how do I know when something is wrong with me? He's like, you're going to have to wait until you're in pain. I still can't understand why this happened to you. Your appendix should have been, before it got to gangrenous, it should have been hurting you. So because my body acted this way, like abnormally, I have to go for additional testing to see if there's like an underlying reason why my body didn't react to this gangrenous appendix, because it should have. It should have been screaming, this woman has appendicitis, it's rotting away in her stomach cavity and needs to be removed. Why that didn't happen, I don't know. Okay, so here's another supernatural part of the story. And I don't know if it was a premonition. It could have just been a crazy dream. You guys know my mom died in July. After that happened, I had a very strange dream. It was my family and I, we were all lined up walking through this park, and I could see ahead of me, there was my mother and my aunt who passed away very close together. They were walking together side by side and laughing, and there was somebody that was right behind them, except for I couldn't make out who it was. Like they were walking weird, like they were struggling to walk. I remember just looking at them like, who is that? And then my mom stopped and turned around, and my aunt stopped and she turned around, and they were like waiting for the person to catch up. Another cousin of mine whispered into my ear. She was right behind me. Like she whispered in my ear, why is she walking so slow? And in my head, I was like, oh, I wonder why she's saying it like that. Like she needs to hurry up. Like I thought these two were close. Why is she saying that? And then I thought to myself, you know what? I should be walking with my sister. Where's my sister? So I turned around, look at the back of the line to see where my sister was. My sister was all the way at the back of the line. And I could see that she was laughing and talking to somebody and having a good time. And I thought to myself, no, I'm not going to call her up here. I'm going to leave her back there. It looks like she's having a good time. And then I turned forward again, and then I woke up. I don't know if it was a premonition in which the order of which we're going to pass away, because the people that have recently passed away were right up there. My cousin that was walking behind them, she's not too much older than me. And my elderly aunt and my elderly uncle, they weren't before us. It was just the cousin, me, and my other cousin. And my sister, who was way in the back of the line, my sister's 17 years younger than me. That's a huge age gap. So I'm thinking to myself, was that a premonition? Like, is this the order of which, like, we're going to start passing away? I know it sounds crazy. I know what you think. I know it sounds crazy, but that happened. So I thought to myself, it probably was just a crazy dream, because what are the chances that like me and this other cousin are going to pass away before these other elderly relatives? Now that this happened, I don't know, maybe it was a little bit of a premonition, but like I said, I have a strong faith in God. I believe, God willing, that I'm going to heaven. If he's good enough to allow me in, I believe that's where I'm going to be with my mom and everyone else that's passed away in front of me. I believe everyone's up there just waiting on us. And life here on earth is just, it goes fast, like the blink of an eye. When you think about eternity and heaven and paradise and being in God's kingdom, how could you really appreciate the splendor and the glory of heaven unless you've been somewhere like earth, someplace where you know pain, where you know suffering? If all you ever know is paradise, however could you appreciate that? So I think that life here on earth is a little bit like kindergarten for the soul. We all have to go through experiences in order to really comprehend and appreciate what paradise is truly going to be when we go up into Father's kingdom. And hopefully I'm a good enough of a person to get there. Listen, it's through God's grace alone that any of us will ever make it into his kingdom, and that's for sure. I don't know how long this is going to be. I feel like I've been talking for a long time. So if you've made it to the end, I thank you. Thank you so much for listening to my story. Thank you for all of your sweet comments and prayers. They have meant a lot to me. I appreciate them. And until next time, wear your sunblock and call your mom and dad just to say how much you love them.